I'm Dr. Craig Joseph.
And I'm Dr. Jerome Pagani, and this is DocTalk. In conversations about health, you sometimes hear people refer to the term disease burden. This is a way of talking about a health problem in terms of its financial cost, mortality, or morbidity. A recent study in The Lancet reported that mental disorders are among the top 10 leading causes of burden worldwide. Worse, there's been no reduction in the global burden of mental disorders in the last 30 years. The pandemic has taken a particular toll on mental health. Researchers estimate an additional 76 million cases of anxiety disorders and 53 million cases of major depressive disorder across the world in 2020. In children and adolescents, it's estimated that rates of depression and anxiety doubled during 2020 and the first quarter of 2021 compared to pre-pandemic numbers.
The upshot of the pandemic has been that the number of people needing care has risen even as access became more limited. This is the perfect use case for modernizing care delivery with virtual mental health services. Evidence-based interventions such as cognitive behavioral therapy and exposure therapy have been successfully delivered through video conferencing and telephone for many years. Behavioral health treatments have changed a lot over the last 2 years, with the ability to access individual and group therapy as well as treatment for substance abuse disorder.
In the past 10 years, over 100 randomized controlled trials, which are considered the gold standard of evidence in medicine, have shown that telehealth delivered via video conferencing or telephone can be as effective as in-person care delivery for the treatment of many common mental illnesses. While there's evidence for efficacy across a wide range of mental disorders, anxiety disorders and major depressive disorder are among the top diagnosed conditions studied to date.
Care delivery has to be funded, and in the U.S., private insurance often follows the government's lead. The final rule of the 2022 Medicare Physician Fee Schedule made audio-only communication a permanent expansion for mental health, including substance use disorders treatment. It also changed the requirement for an in-person visit from every 6 months to every 12 months. Some private payers are beginning virtual-first health plans which include behavioral services. Major private payers have extended cost-share waivers for behavioral telehealth during the pandemic and expect demand for virtual behavioral health to continue after the pandemic. While the health sector is currently wrestling with what the actual demand for telehealth will be once the numbers truly stabilize, behavioral telehealth is here to stay. Why? It has a 20-plus year history, albeit with a slow build-up, and proven clinical efficacy. It was a top health service used during 2020 and 2021, and while CMS is still deciding on what telehealth benefits will stay or go, it permanently made behavioral telehealth available for all Medicare recipients. Combine this with a global mental health crisis and a shortage of healthcare workers, service demand and accessibility needs are high. While a telehealth strategy is important to consider for every specialty, health systems looking to offer holistic care for the populations they manage need to pay particularly close attention to virtual mental health services that make the most of what looks like a permanent change to reimbursements. Are you having office hours?